So there are two situations where patients would be evaluating an implant decision. The first would be if they have a tooth that's going to be removed in the near future. And the second situation would be if a patient has lost a tooth historically. And so in all those situations, it's important that the dentist and the patient talk about what the bone situation is like around that tooth, or if the tooth has been removed, what the current bone situation is. Because, in a perfect world, we try to remove teeth and prepare the site immediately for an implant placement, which really, if it happens that way, the process can take as short as 5 or 6 months, but sometimes as long as 9 months. But basically, what happens is once the procedures takes place, the implant is placed into the jawbone, and the bone, after a healing period, has basically become fused with the root. And then eventually it pretty much becomes very much like a tooth root, except it's made of this biocompatible material, titanium. And when it's all said and done, it's easy for a patient to maintain and clean. They can floss, brush that tooth just like it's any of their other teeth. And so patients tend to really get the best benefit from an implant, because decade after decade after decade, because it tends to be a very good long-term restoration.